A slice of ginger a day keeps the doctor away. Greetings to all our viewers. When should you use ginger, and when should you avoid it? Ginger is one of the most common spices and an herb with numerous health benefits. Both modern and traditional medicine have demonstrated the advantages of regular ginger consumption. Ginger can be a powerful remedy for many conditions. For thousands of years, ginger has been used to prevent scurvy, a condition caused by a deficiency of vitamin C. Scurvy can lead to anemia, body weakness, fatigue, spontaneous bleeding, pain in the limbs, especially the legs, swelling in certain parts. So what are the specific benefits of ginger, and what should you be aware of when using it? Stay tuned for today's video. In the 14th century, half a kilogram of ginger was worth as much as a sheep. Ginger was very expensive and was one of the first spices to be exported from southwestern India. In the United States, it is very common, but the question is whether we are using it. Ginger is known for its strong anti-inflammatory and antioxidant properties. It has a very high antioxidant value, even higher than that of pomegranate juice. Ginger contains many anti-inflammatory and antioxidant compounds, such as gingerol, paradol, squitpins, and zirambone. These compounds help protect the body from damage caused by unstable molecules called free radicals. Many studies on animals and in test tubes have shown that ginger extract reduces inflammation in people with conditions like rheumatoid arthritis, inflammatory bowel disease, asthma, and some types of cancer. Other studies have also shown that people with type 2 diabetes who take 2 grams of ginger powder daily have significantly reduced levels of inflammatory proteins like tumor necrosis factor alpha and C-reactive protein compared to those taking a placebo. Additionally, other components in ginger juice, such as lemon and turmeric, also have strong anti-inflammatory and antioxidant effects. Ginger is also known for its immune-boosting properties. Due to its strong anti-inflammatory and antioxidant effects, ginger can enhance immune health. While acute inflammation is an important part of the normal immune response, chronic inflammation can harm your immune system, increasing your risk of disease. By increasing the intake of antioxidant-rich foods and drinks like ginger, you can combat inflammation and keep your immune system healthy. The third benefit is reducing nausea or other digestive issues. Ginger is used to help treat stomach problems, bloating, and indigestion. Studies also show that adding ginger to your diet can help enhance gastric motility, improve indigestion, reduce bloating, and decrease intestinal cramps. Additionally, ginger is very effective and safe in reducing nausea symptoms in pregnant women, as well as those undergoing chemotherapy or surgery. Notably, animal studies have shown that ginger can protect against and treat stomach ulcers. Ginger also has numerous other benefits, such as blood sugar control. Some studies note that supplementing with ginger can reduce blood sugar levels and improve hemoglobin A1C, an indicator of blood sugar control. It can also aid in weight loss. Ginger has been shown to significantly reduce body weight, decrease feelings of hunger, and increase the thermic effect of food, the number of calories burned during digestion. Moreover, ginger is known for its cancer preventive properties. Research indicates that ginger and its compounds in ginger juice may help protect against certain types of cancer, including pancreatic cancer, thanks to its antioxidant properties. In fact, when comparing vitamin B6 to ginger, ginger proves to be more effective. While ginger is very healthy and safe for most people, it does have some potential side effects. For instance, consuming high amounts of ginger can thin the blood. However, this is still a controversial issue, as some studies suggest ginger does not have this side effect. To be on the safe side, individuals on blood-thinning medications should avoid. Ginger can also lower blood sugar levels, so people with diabetes taking blood sugar medications should use ginger in moderation. Children over 1 year old and under 12 should consider or consult a doctor before consuming ginger-containing drinks. So, how much ginger should we consume daily? It is recommended to consume about 4 grams of ginger per day. Consuming more than 6 grams of ginger daily may cause some health issues, such as digestive problems, diarrhea, heartburn, or acid reflux. It may also negatively affect the heart and blood vessels, causing low blood pressure or arrhythmias. Increased bile acid secretion can also be an issue, as the liver produces bile acid and the gallbladder stores it. Excessive secretion can lead to the formation of more gallstones. Here's how you can use ginger at home. For this recipe, we'll use fresh ginger entirely. Select a piece of ginger, then finely grate it. After grating, place the ginger in a sieve and separate the juice. We'll only use the juice. You can store the ginger juice in small glass jars and keep them in the refrigerator. Ginger juice can be preserved for a week, but for the best results, it's recommended to consume it within 3 to 4 days. Now, I'll guide you on how to make a glass of ginger water. Prepare 1 teaspoon of honey with 150 milliliters of water, then add 15 milliliters of ginger juice, mix well, and enjoy. This drink is suitable for everyone and can be consumed at any time. However, using dried or roasted ginger can cause body heat, leading to difficulty sleeping. Therefore, it's best to avoid consuming it in the evening, and remember that ginger is most effective when taken in the morning after a meal. If you have any of these 5 conditions, avoid turmeric to prevent health risks. Turmeric is widely known as a common spice used in many dishes. Besides culinary uses, turmeric is also extensively applied in traditional medicine for its remarkable health benefits. However, for some people, consuming turmeric can be harmful, even leading to multiple organ failure, anaphylactic shock, and life-threatening conditions. So, what exactly are the benefits of turmeric, and who should avoid it? Let's find out in today's video. According to Dr. John Smith at Mayo Clinic, turmeric is an excellent medicinal herb with high anti-allergic properties. This is due to its active compound, curcumin, which has strong anti-allergic and antioxidant effects. However, some people are allergic to turmeric. While turmeric is known to be a beneficial herb, how much turmeric is enough? Studies typically use doses ranging from 200 to 2,000 milligrams of turmeric daily, often in extract form with higher concentrations of curcumin than found in natural foods. For osteoarthritis, 500 milligrams of turmeric extract is used twice daily for 2 to 3 months. For high cholesterol, 700 milligrams of turmeric extract is used twice daily for 3 months. For skin itching, 500 milligrams of turmeric is used 3 times daily for 2 months. Organization WHO has determined that an acceptable daily intake is up to 1.4 milligrams per pound of body weight. Turmeric has many health benefits, but certain people should avoid it. According to doctors, some individuals should not use turmeric powder or turmeric extract due to potential health risks. 1. Pregnant women. Turmeric extract can reduce blood clotting, cause bleeding, and stimulate the uterus. Pregnant women should consult their doctor before using turmeric. 2. People with anemia. Turmeric can dissolve stagnant blood and bruises in the body. For those with anemia, this can lead to dizziness and severe iron deficiency. To improve anemia, consider using vitamin and mineral supplements that provide iron and folic acid. 3. Diabetes patients. Curcumin in turmeric can lower blood sugar levels. Diabetic patients should be cautious when consuming turmeric powder to avoid dangerously low blood sugar levels. It's best to consult a doctor before using turmeric. 4. People with acid reflux. While many studies show turmeric is effective in treating digestive disorders or stomach pain, it can interfere with antacid medications. When used with antacids like omeprazole, ranitidine, or pantoprazole, turmeric can increase stomach acid, causing unwanted pain. Avoid using turmeric powder with these medications. Kidney stone sufferers. Kidney stones form from the deposition of salts and minerals like calcium oxalate. Turmeric contains high levels of oxalate, which can bind with calcium and form kidney stones. Experts advise those with kidney stones and bile duct obstructions to be cautious when using products containing curcumin. 6. Individuals preparing for surgery. Turmeric can prevent blood clotting, so those scheduled for surgery should stop consuming turmeric about 2 weeks before their procedure. If consumed in excess, turmeric can lead to excessive bleeding and difficulty in stopping the bleeding post-surgery. According to the Precious Plants, turmeric is spicy, warm, and targets the liver and spleen. It can break down clotted blood, heal wounds, promote tissue regeneration, and stop bleeding. However, it should not be used if there is internal heat without stagnation. Postpartum conditions without heat or stagnation, pregnant women, and those with prolonged menstrual bleeding should also avoid it. It's crucial to use turmeric in appropriate amounts, whether in pill form, powder, or fresh, and always consult a doctor if you have underlying health conditions. Warning: 3 foods stored overnight in the fridge can turn toxic and harm your health. At home, when there's leftover food or an abundance of food, the first thing we usually do is store it in the refrigerator. However, improper storage can make some foods harmful, turning them into poison and causing cancer, significantly shortening your lifespan. So which foods are these? Let's explore in today's video. 1. Pork. Many people freeze pork to consume gradually over time. Nowadays, contaminated food is a significant concern in our modern lives. With increased use of chemical technology in farming and animal husbandry, food is losing its organic quality. This consumption of non-organic food leads to a decline in nutritional quality. More dangerously, a family in Hangzhou, China, recently had to be hospitalized after eating pork that had been stored in the fridge for a long time. Whether it's clean pork or any other meat, it should not be stored in the fridge for more than a week. According to experts, many urban families buy clean pork and store it in the freezer to consume over time, especially when sourcing from the countryside. However, eating meat stored for long periods is a bad habit. The longer meat is kept in the freezer, the more nutrients it loses. Storing meat for up to 6 months not only depletes its nutritional value, but also increases the risk of food poisoning, stomach aches, diarrhea, dizziness, nausea, and high fever. Experts recommend storing meat in the freezer for no longer than a week and in the fridge for only 2 days. Processed meat can last 3 to 5 days. Meat stored too long in the fridge can harbor harmful bacteria that erode nutrients and spoil the flavor. Many believe refrigerating meat ensures its quality, but bacteria and parasites can still be present, gradually producing toxins that infiltrate the meat. Long-term consumption of such meat can affect your health and that of your family. 2. Bananas. This might sound strange, but bananas are a favorite fruit for many families, often bought in large quantities and stored in the fridge. However, have you considered that this might negatively impact your health? Why shouldn't bananas be stored in the fridge? Bananas are rich in nutrients, including 8 essential amino acids that the body cannot produce, 11 minerals, and 6 important vitamins. Additionally, the serotonin precursor in bananas is crucial for quick thinking, learning, and cardiovascular regulation, especially in children. Despite their nutritional value and affordability, experts warn. The full benefits and potential risks of turmeric and banana consumption highlight the need for informed dietary choices. If in doubt, always consult healthcare professionals. This is not a good habit at all. At temperatures between 4 to 8 degrees Celsius in the refrigerator, bananas can easily turn black, degrade, and even freeze and rot. This not only affects their taste, but also negatively alters the nutrients inside, impacting your health. In macrobiotics, bananas are considered a yin food, high in acidity. When stored in the refrigerator, they become extremely yin. Therefore, when you're sick, tired, or feeling cold, consuming refrigerated bananas can worsen your condition. Instead of storing them in the fridge, you can keep bananas fresh longer by choosing those that are just ripe with green stems and checking carefully to ensure there are no bruises. Bananas should be stored in a cool, ventilated place at room temperature of around 77 degrees Fahrenheit, avoiding direct sunlight and heat from the kitchen. Bananas should be placed separately, as storing them with other fruits will cause them to ripen faster and lead to spoilage. Avoid using plastic bags to wrap bananas, as the ethylene gas they produce cannot escape, causing the bananas to turn brown. If you still want to eat refrigerated bananas, wrap them individually in newspaper and place them in the refrigerator's cool compartment. This method can keep bananas for 6 to 8 days. 3. Do not eat eggs stored in the refrigerator. Boiled eggs are a favorite dish because they are simple, quick and convenient to prepare. Some people even boil eggs the night before to eat them the next morning. But is it safe to eat boiled eggs left overnight? From a food safety perspective, you should not eat food left overnight as it can easily become contaminated and negatively impact your digestive system. However, whether boiled eggs left overnight are safe to eat depends on how you prepare and store them. Boiled eggs left overnight without refrigeration should not be eaten because, according to the Food Safety Department, cooked food is safe to consume within 2 hours. Cooked food left in temperatures between 4 to 6 degrees Celsius can still allow bacterial growth, leading to food poisoning. Thus, boiled eggs left overnight should not be eaten if left at room temperature. Boiled eggs stored overnight in the refrigerator can still be eaten. However, after boiling, let the eggs cool and then refrigerate them immediately. Additionally, do not peel the eggs before storing them in the refrigerator. Keeping the shell on increases their storage time. When storing eggs in the refrigerator, you should eat them the next morning, not leave them too long as this can affect the quality of the eggs. The hidden dangers of eating eggs left overnight and improperly stored. According to the Food Safety Department, bacteria can grow in processed foods at temperatures between 4 to 6 degrees Celsius. Therefore, boiled eggs left overnight that are not properly stored within 2 hours after cooking and eaten the next morning have a high risk of food poisoning. The most noticeable symptoms of food poisoning are stomach pain, vomiting, and diarrhea. Stomach pain occurs because the stomach and diaphragm muscles contract strongly, causing vomiting to expel food from the stomach. This can be understood as the body's natural defense mechanism against harmful agents. Besides food poisoning, you can also experience digestive disorders from eating boiled eggs left overnight. This is caused by the increase in harmful bacteria causing the food to ferment in the stomach, disrupting the body's natural digestive process. Eating food left overnight and improperly stored can particularly lead to diarrhea and dehydration. You may also experience a mild fever due to bacterial infection from overnight food. If the fever persists and does not improve, it is best to see a doctor for medical treatment. Below are some delicious and appealing egg dishes.